At Prevent Blindness, we promote healthy vision and access to eye care for all. We educate people about protecting their sight. We advocate for strong vision policies at the local, state, national, and global levels. We empower the blind and low vision community and their allies, and we celebrate their achievements. Here's your host, Christopher Horde.
Greetings. Welcome to the Prevent Blindness Focus on Eye Health podcast. I'm your host, Christopher Horde. This November marks our final episode of our 2025 season. We'll be taking the holidays to plan for our second season, which launches in January of 2026. To finish up the year, we have a special episode. In November, Prevent Blindness observes Diabetes Eye Disease Month. Since diabetes is a condition that touches virtually everyone's lives in some way or another, we have a special roundtable discussion about diabetes eye diseases, their prevention, and improving the quality of life for the entire blind and low vision community. Our guests include Dr. Rajiv Ramchandra. Dr. Ramchandra is a member of the Flom Eye Institute at the University of Rochester. He is part of an interdisciplinary team deploying strategies to achieve universal vision health and eye care in Western New York. We also have Talana Townsend, a person with diabetic retinopathy. Talana is also president of Visually Impaired Advocates in Houston, Texas, where she lives. She works to promote inclusion and respect for the blind and low vision community and to provide support for that community and family members. Finally, we are joined by Nita Sinha, Senior Director, Public Health at Prevent Blindness, who will discuss some of the initiatives that the organization is leading. We think you will find this special episode both informative and inspiring. Keep listening. It starts right now.
Feature presentation.
Greetings, everybody. Welcome to a special event here on Prevent Blindness Focus on Eye Health podcast. In honor of November, which Prevent Blindness observes as Diabetes Eye Disease Month, we have a couple of people here with us who are going to talk about some of the work they're doing and their experiences relating to diabetic eye diseases. Our first guest is going to be Dr. Rajiv Ramchandra, who is with the Flom Eye Institute of the University of Rochester. And we have Talana Townsend with us, a person who has diabetic retinopathy and is also the president of, and I'm sorry, it's, what is the name of the organization again, Talana?
It's the Visually Impaired Advocates Houston.
That's right. And so they're going to be talking to us, and we also have Anita Singh from Prevent Blindness, who is our Director of Public Health. So did I get that right, Nita?
It's Sinha.
Sinha. Okay, I'm very sorry.
That's okay.
All right, so we've got everybody on board here. So I'm going to start by sort of going around the circle a little bit so our listeners to get to know a little bit more about you and the things that you do. Dr. Ramchandra, we'll start with you. Would you tell us a little bit about, I guess, what led you to get involved in your field of study and what your area of concentration is right now?
Sure. So I am a vitreoretinal surgeon. So that's an ophthalmologist or an eye doctor who deals with the back of the eye and can do surgery for the retina, which is a layer inside the eye in the back wall of the eye. And that's what receives light from the outside and processes that light into a signal that goes to the brain. And that's how you see. So the retina is very important in sight. It's a very main part of the eye there. And how I got involved in all of this is that my aunt, who was in India at the time, had bilateral retinal detachment. So she had a problem with her retina in both eyes and needed to have immediate emergent surgery. She had some surgery done in India, but it wasn't successful and was brought to the United States and had successful surgery at Wills Eye Hospital, which is the first and probably only fully eye hospital dedicated to the eye in the United States. And so she had her sight saved, and that inspired me as a child to go and become a retina specialist like I am today.
Fantastic. Thank you. And I think probably one of the things we should mention, I know that you are part, from what I've read, of an interdisciplinary team that is working on helping to deliver eye health in general to the population. Could you tell us a little bit more about that?
Sure. So I direct population health at the Flom Eye Institute as part of the University of Rochester in Rochester, New York. And our mission is to reach out to people before they become patients of having eye disease. So we want to reach out to those at risk. And those people with diabetes especially are at risk for having eye disease and vision loss. And we want to get to them before they end up with symptoms or even signs of eye disease. So education in the community, working with community health workers and volunteers in the community. We're working with mental health specialists and social workers because there's a large burden of social issues for people with diabetes that prevent them from getting eye care, and also mental health issues in this population. So we're really working with a diverse group of people along with primary care providers, because that's where folks with diabetes come to see first, as their primary care provider, to get the treatments for their diabetes. And so we want to go upstream to get people before they start having symptoms of eye issues so that they can be proactive about preventing eye disease. And prevention is the key thing. That's why we work with Prevent Blindness, because they also believe in this aspect.
Yes, indeed. And along those lines, I'm sure a lot of our listeners are wondering if they have concerns about this issue. Where would you recommend they get started? Is there a particular source of information, or should they consult with their eye doctor first, or their primary care specialist, or what should they do if they're feeling concerns?
Right. So the first thing is to know if you have diabetes or not. And if you have a family history, if you have various signs and symptoms, like you're thirsty a lot, or you're frequently going to urinate, or you're seeing that you're losing weight, a lot of those things are related to having diabetes and feeling tired a lot. So those are things that you need to go see your primary care doctor and get checked out immediately. Primary care doctor is a great source of information. Their office has a lot of resources to educate people. And then specifically for eye disease, they can often refer you to a local eye care specialist to have an exam and to make sure that you don't have any eye disease. And you can talk to them more about these conditions. In addition, Prevent Blindness is a great resource. They have online resources as well as print resources that can be very helpful in educating people in simple terms. Sometimes our medical terminology is a bit complex, and not everybody has a medical degree to understand it. So it's really important to have simplified language and straightforward means of understanding what you're going to face if you have diabetes as far as your eye goes.
All right. Thank you very much, Doctor. We'll get back to you in a little bit, but I want to take a moment here and move on to talk a little with Talana Townsend. Talana, would you please tell our listeners a little bit about yourself, about your background, and especially about your journey as it relates to vision care and eye health?
Sure. I was told that I was a diabetic at the age of 7. And I do have a long family history of diabetes. My mother, my paternal and maternal grandmothers were both diabetics. And so I knew early on that I had diabetes type 1. That I was a type 1 diabetic. Um, Throughout my adolescent years, I'm not going to say my mother was strict on me. she was a little strict, but she was a little lenient too. And in my situation, I can recall that I never went to an eye doctor. And I didn't go to an eye doctor till when I got it in my, when I was 28. No, not 28. When I was about 27. And I started getting symptoms of blurriness in both eyes when I was driving at night. And that's when I started going to the eye doctor. And not knowing, not being educated, going to an endocrinologist to keep up with the diabetes, I was always told that it can mess with your eyesight, it can mess with your kidneys. And I was always told those things. So I knew that. But and I'm just going to be open and honest, just relax and be myself. When I was from under my mother's thumb, I did what I wanted to do. And that was when she wasn't around me 24 hours, especially when I went to college. So going to college, I know that I probably flew off the handle with my diabetes. And it wasn't as controlled when I went off to college by myself. And then once I came back home, I kind of got it together. And at the time that I started losing my sight, I had an A1C of a 6.5. I was doing good. But because I had never been to an eye doctor in my life, that wasn't common for me. I didn't know. I wasn't educated on that end of going to the doctor regularly. I heard it, but my mom didn't do it. My dad passed away when I was 10. So I was raised with just a single family household, which was my mother, and I have an older brother. But when I started losing my sight, it just went away just instantly. And when I say instantly, where I woke up, went to work one day, and I started my day and I couldn't see. So with that being said, I went through that. Then I decided to go to the eye doctor because I don't know what's wrong with my eyes. And when I did that, they sent me to a specialist and they said that both of my retinas were detaching in both of the eyes at the same time. And with that being said, with the eyesight leaving, a month after that, I became on dialysis. So my eyesight 1 month, dialysis the next month. But I'm glad to say that I am a kidney transplant recipient as well. So this for me is something that I got into advocating. And the organization that I'm president of, I've been in the organization since 2015, and it's the Visually Impaired Advocates of Houston, where we advocate for preventing our blindness, advocating for our awareness of what's going on in all forms and fashions. And that's just me in a nutshell that I didn't know.
That's very good, Talana. Thank you. And I will also ask you this, based on your experiences, especially some of the things you've talked about, the things that you did not know, would you have any suggestions to listeners, things that they may want to check out, even if they're just going through their day-to-day lives, just to make certain that things are going okay?
For the listeners, I would tell them, especially if they're a diabetic, to stay abreast with your appointments. Go to the eye doctor. It can be scary, but go to the eye doctor because I feel that I could have prevented some of what I had going on if I would have went to the eye doctor throughout my adolescent years when I was growing up, or doing a regular routine checkup for not to know that my retinas were detaching at the same time in both of my eyes, to lose all my vision with both of my optic nerves just going completely gone. So I would tell anybody, stay aware, get educated on your eye disease, even if it's diabetes. Is my passion, because now that I know, I like to spread the word to others who are coming along that are close to losing their sight. Still go to the doctor. Because you run into people that say, "Oh, it's already gone. I don't have to go to the doctor." No, you still have to go because some of this stuff can be preventative. So I will tell anybody that's listening, do your routine checkups. Go to the doctor. Go to a specialist if you have to go to a specialist. Know your condition so that you'll be educated on what's going on with you personally.
All right. Thank you very much. And now for a second, we're going to turn to Nita because I know that she has an announcement to make on some work that we are doing here on Prevent Blindness. So I'll ask you to go ahead and tell the listeners a little bit about that.
Oh, well, thank you. Well, Dr. Ramchandran and Talana have really kind of said a lot about education and how important it is, and really the importance of getting eye exams and having information that's understandable to the lay population versus, or to a patient who's not in the medical profession. And so Prevent Blindness has a wealth of resources available on our website. And we have information we have web pages, we have fact sheets that are printable, we have videos, and these videos and all these items talk about, mental wellness. They talk about signs and symptoms, the importance of getting an eye exam, diabetes when you're young, and the importance of eye care, just as Talana was mentioning for herself. And so this can be all found on the preventblindness.org/diabetes webpage. But one thing I really wanted to mention is that we have a new resource out, which is called the Prevent Blindness Eye Health Audio Library. And we're launching it this month in November. And this audio library is free. You call in. It's available 24/7. It's available in English and Spanish. And it provides information around diabetes-related eye disease. And it'll provide information around how to protect your eyesight, how to get ready for your eye exam, how is your eye health affected if you're pregnant, what to do if you're newly diagnosed with diabetes, and it provides tips on, what the importance of eye care is, and resources for accessing eye care services, and how to go about that. And so I highly encourage the folks listening to call this number. It's free, and the number is 1-833-998-5850. Again, it's 1-833-998-5850. And that's the Eye Health Audio Library. And, I highly encourage you to visit our website, call the number, and, really just go get an eye exam. If you have diabetes, it's important. Take care of your eyes.
All right. Well, thank you so much, Nita. And first of all, I want to thank you all for being guests on the podcast today. But since I've got some folks here who are very knowledgeable about different aspects of this topic, I'm going to take a moment or two and just ask a couple of general questions and try to get some feedback for the listeners. One of the things that I'd like to start by asking, and I'll start with you, Dr. Ramchandran, but this will be for anyone who'd like to chime in. Talana, you may well have some stuff for this as well. What kind of resources are commonly available for people to look for if they don't really know where to start? Because that's the thing, a lot of people necessarily don't have money for medical care, or they don't know where to get medical care that they can afford. Are there resources that they should especially be looking towards as far as eye health, or just sort of where might they begin, and what might they want to research?
Sure. So, of course, the internet, if you have access to it, is full of facts and figures, but you need to know where you find the trusted and true sources of information, right? So, in fact, the Centers for Disease Control has a Vision Health Initiative, the VHI. And in the Vision Health Initiative, you have a lot of great resources around diabetes, because vision in the CDC actually lives in the diabetes prevention group, because how vision is really seen as a part of a chronic disease is part of diabetic retinopathy and diabetic eye disease. So it's a really great source of wonderful information on that. Other sources include the National Eye Institute, which is another taxpayer-funded organization that has the National Eye Health Education Program. So there's great resources that way, like we talked about, and Nita was talking about the Prevent Blindness resources that are online, which is another very trusted site, because those resources are vetted by various eye doctors, ophthalmologists, and optometrists around the country. So they're all studied and reviewed by these folks, so you get some expert opinions. Other areas include the American Academy of Ophthalmology and the American Academy of Optometry, another great resource for education on patients. And they have patient-friendly or people-friendly resources that are not all in medicalese. They're very easy to understand, and a lot of pictures and a lot of videos, and that's very, very helpful to look at. So there are a lot of online resources, but you have to go to credible sites to get that information. Apart from online, your local library has a lot of great resources around this, and the librarian there can help direct you to find great books, and can even help you get online to find resources that are credible and will give you good information around this. But I'm very curious how Talana found out her information. She has diabetes when she was very young, and I was wondering how she would get this information at age 7. It's hard to deal with such a big diagnosis at such a young age.
Yes, please, Talana. Please tell us more.
Well, most of my resources or the information I did find out being an adolescent was from going to my endocrinologist, my diabetes specialist. So they was giving out a lot of paperwork. At that time, yes, I'm 7 or I'm 8, but I know I had to get my mother to and my father to read that and break it down in a form where I could understand. And so that did a lot for me. And then as I grew older, I kind of researched on my own, going to the library, doing those different things just to know what I had going on, what I kept up with my dietitian to know what I was not supposed to eat and what I am supposed to eat, or how I could interact what I like to eat. And being a young child, you don't like to hear no. That you can't have this, or you have to watch this, or you can't do this. And at that time, I wasn't counting carbs or doing anything like that. But the resources, the little educational classes that I did receive from my endocrinologist back then, they were very helpful for me in the long run. But I was just hard headed, and I'll be honest, I was just hard headed. But as I grew older and I began to understand what it did to my body and what it has done to my body and to my eyesight, I a resource now that I try to tell a lot of people to do is go to the lighthouse. If your city has a lighthouse, they have the diabetes classes there where you can come and you sit in the class. It might be twice a month, but they're very educational, and they do it on Zoom, and that's our world today. The Zoom platform, the teams and things like that, the teams meet and things like that. So you have resources. Join a support group. Why I say that is because they're in the support group that I'm the president of. We have several different eye conditions, but most of the condition is due to diabetes. And everybody's journey is different, but somebody might have a resource that I don't have that share that with me that I could share with somebody else. So being around like-minded individuals that are going through what you're going through, you can also use individuals as major resources.
All right. Thank you, Talana. Now, and also, while we're on that note, since we have really emphasized how much learning and knowledge is important here, I'm actually going to circle back around and ask Nita to give that URL and the phone number for the audio library again. And if you have anything you want to add as far as telling people about the resources available, please do. But let's give them that information again so that they can look things up if they are concerned.
Great. Well, thank you. For the Prevent Blindness Eye Health Audio Library, that phone number once again is 1-833-998-5850. Again, it's 1-833-998-5850. And, you can call anytime. It's available in English and Spanish. And if you'd like further information, there's information that can be texted to you. So that information, you will have some resources that you can get from Prevent Blindness. And our website for Prevent Blindness is preventblindness.org/diabetes. And there we have resources available. We have web pages, we have fact sheets, we have videos to help educate you. We have videos for those who are newly diagnosed and for those who have diabetes in youth. And we also have resources available for those who need financial assistance. So looking for eye care and you're not able to provide for it, there's resources available there as well. So I highly encourage you to check those resources out.
Fantastic. I think we have probably given the folks a pretty good amount of information. But before we sum up, first, Dr. Ramchandra, I'd like to ask, how would people, folks who maybe want to find out about the project that you're working with at the Flomai Institute, find out more information? And if there are any particular projects that you're working on or anything like that you'd like to highlight for our listeners, or something that they can get involved in, or they might simply want to find out more about?
Definitely. Thank you for the opportunity to talk about my work. So as I said, I direct population eye health at the Flomai Institute. So if you go to our website, flomaiinstitute.org, as part of the University of Rochester, that will take you to a site called Healthy Eyes. And Healthy Eyes is an initiative that we're working on to increase awareness of eye disease in the community. We have a lot of volunteers who come under our Mobilize initiative to go out and perform vision screening and to promote eye education and eye care in various settings, including schools and including primary care offices that are not eye care sites, and also in the community with community screenings and exams that we do. So if you go to the Flomai Institute at the University of Rochester, you'll find more information under Healthy Eyes.
Thank you very much. And Talana, why don't you tell folks a little bit more about how to find out about your organization for folks in the Houston area, and highlight anything else you'd like to share with us?
We are the Visually Impaired Advocates Houston. We do have a website. The website is VI Advocates, spelled out with the S.org. And on our website, it lists a plethora of information because we house like information for inner city organizations in the visually impaired community. In the visually impaired community, as well as anything for anyone that's doing anything on Zoom, and it can be zoomed in from other states. If they send it to our website, we have a form on our website that you can send it to, and we post this information there. We post it on our website, and we update the website weekly. So as information comes in, it stays on there until, if there's a deadline, then we leave it. We take it down after the deadline has matured. If not, it stays there for until somebody tells us to take it down. But also, we do meet in person in Houston at the Metropolitan Multi-Service Center at 1475 West Gray Street, Houston, Texas, 77019. As well, we do all our meetings per Zoom. On the website, my email address is there, which is talana.townsend, which is TALANA.TOWNSEND and anyone can feel free to reach out to me, and I will forward them the Zoom link because I am the communications chair for the organization.
All right. Thank you very much. And I think this has
Thank
been
you.
some really great information. Folks out there at home, please do try to take command, take charge of your condition, learn more, and be active in your care. Before we go, I just want to check, is there anything important that any of you folks feel that we have left out?
Well, I think one of the most important things to tell people who especially have diabetes is how often to get their eyes examined. Really, the American Academy of Optometry and Ophthalmology really stressed that a yearly eye exam is very, very important. And if you can't get in to see an eye doctor, because often eye doctors are busy, there are not many around, maybe where you live, it's really important at least to get an eye screening. A lot of offices, primary care offices, and even Walmarts and CVS's, a lot of drugstores out there have cameras that can take pictures of the retina, of the back of the eye, and can detect retinopathy or eye disease that way and link you to an eye care specialist. And so at least get your eyes screened every year, if not a full eye exam. But really, it's important to connect with an eye doctor. Just like you have maybe an endocrinologist or definitely a primary care doctor, you need to connect with an eye doctor and have that as one of your main doctors if you have diabetes. Because diabetic retinopathy is a silent disease until you suddenly, boom, end up with vision issues, as Talana found out. You've had it for many years, and it slowly creeps up on you, and the damage is being done in the eye, and you don't even know it. The silent disease can suddenly manifest into vision loss, and you have to catch it before it does. So really important, just like some people get their cars inspected every year and they want to keep driving, you got to get your eyes inspected every year so you can keep seeing and keep living a good life.
Very good. Thank you, Doctor. All right. Well, I want to thank you all for being on the podcast, and I wish you all the best with your various endeavors.
Thank you.
Thank you.
Announcements.
Thyroid Eye Disease Week is November 10th through November 16th. Thyroid eye disease, or TED, is also known as Graves' ophthalmopathy, or Graves' eye disease. It is an autoimmune disease in which the immune system causes inflammation and swelling. This leads to abnormalities within muscle tissue and fat behind the eye. An overactive thyroid gland is usually caused by Graves' disease. As many as 1/2 of the people with Graves' disease will develop thyroid eye disease. This year's TED Week is sponsored by Amgen Rare Diseases and Viridian. Find out more at preventblindness.org.
Listen to the podcast from our website at preventblindness.org or subscribe to it on all major podcast services, including Amazon, Apple, Spotify, and YouTube. This has been your announcer, Corey M. Snow.
Thank you to each and every person who has listened to an episode of the Prevent Blindness Focus on Eye Health podcast. You, our listeners, are the reason we make this program and what makes this program possible. This first season has been a fascinating journey together. We've spoken to people from all walks of life, about their relationship with vision, health, and eye care, and the universal quest for inclusion and quality of life. We hope you find it informative and inspirational. This is the last episode of the 2025 season. We'll be busy preparing for Season 2, which will debut in January of 2026. And we look forward to having you join us for some exciting new episodes. On a personal note, I would like to take a moment to thank the staff of Prevent Blindness. Their enthusiasm, support, and advice has been invaluable in turning this notion into a reality. My thanks go out to them. Please make sure to join us in January 2026 for the premiere of Season 2 of the Prevent Blindness Focus on Eye Health podcast. Until then, we wish you a happy holiday season. This has been Christopher Horde. Enjoy and share.